What's going on, everyone? It's Dr. Sean, your physical therapy application coach, and today I'm excited to share with you this video about board certification specializations within the profession of physical therapy. That's right, after receiving your doctor of physical therapy degree, there are opportunities for you to go on and receive additional specialty training to help you serve your patients by gaining a broader skill set, more specifically related to your area of interest. There are individuals who receive multiple certifications as well, so don't feel like you're pigeonholing yourself if you choose one, but it's always good to learn about these options in our profession that are available to you. Some of them are very commonly known: orthopedics, pediatrics, neurology, sports physical therapy, as well as women's health. These are some of the most popular ones, and many individuals on social media who have these certifications kind of have made them broadly aware. There are also a variety of other ones that may be less commonly known that I wanted to spend more time on today and give you a little bit of perspective and insight about the different opportunities that are available for you to receive specialty certification. Let's go ahead and go to the American Physical Therapy Association's website under board certifications to help us learn about each of these. And guys, if you like the videos that we are posting, if you're enjoying the content we're creating, it would help us so much if you like this video, subscribe to our channel, hit the notification bell, and also if you haven't already, go ahead and subscribe to our free bi-monthly email newsletter where we go over topics like board certifications in a lot more detail, and you won't want to miss out on this great content. Without further ado, let's go ahead and head over to the American Physical Therapy Association's board certifications website. I'll see you there. All right, guys, here we are on the American Physical Therapy Association Specialist Certification page. This is governed by the ABPTS, and some things I wanted to point out first. The certification programs, these specialist certification programs, are voluntary. You do not have to engage in them, okay? And it's at the request of the individual. It is a non-restrictive process, so it doesn't mean that that once you gain a certification, you're going to be prohibited from treating in other areas, or that you aren't going to be able to change that, right? It's not like you're not pigeonholed in that area. And then also that you don't have to have a board certification specialty to practice in other areas as well. It's just going to give you additional training and skills. This is a coordinated process as well. So this third point, there's a central mechanism provided for certifying specialists to make sure that your certification is up to the standard that is approved by the ABPTS, which is important to make sure that the residency program that you are a part of is going to help you be successful, and to ensure that it's a good quality residency program. So the minimum eligibility requirements for a specialist certification: you must hold a permanent or unrestricted license, and it must be current to practice physical therapy in the United States or any of its possessions or territories. There has to be an evidence of a minimum of 2,000 hours of clinical practice in the specialty area, 25% of which must have occurred within the last 3 years. Okay, so those are important things to consider. Now let's go take a look at the actual specializations themselves. All right, so here we are on the different specialty areas. Let's go through each of them real quickly. Cardiovascular and Pulmonary, Clinical Electrophysiology, Geriatrics, Neurology, Oncology, Orthopedics, Pediatrics, Sports, Women's Health, and Wound Management. So, as I mentioned previously, a lot of these are much more well-known. Today, we are going to go over more specifically cardiopulm, clinical electrophysiology, oncology, and wound management. Okay, so if we look here at becoming a certified cardiovascular and pulmonary clinical specialist, we know that in the first examination for this specialization was administered in 1985. So it's been around for a while, but there's only 378 cardiovascular and pulmonary specialists. So it's not as diverse as orthopedics, which has thousands of individuals who are currently certified in that, right? And this is as of June 2020. So you're going to be working primarily with individuals who've had any type of cardiovascular incident, wherever that may look like, and you're going to be helping rehabilitate them, more specifically geared towards their cardiovascular system. You're going to learn a lot more about the heart and lungs, the different tools to help monitor that, and to ensure that you can help rehabilitate these patients safely. So that is the cardiopulmonary clinical specialist. There's obviously a lot more details that we can go into, but this may be an area that you previously weren't aware of. Okay, so this is probably one of the least known board certified clinical specialties. This is the electrophysiologic specialty area. Okay, and it encompasses those areas of practice that use electricity to monitor, measure, or produce physiologic responses in the evaluation, treatment, and prevention of human dysfunction. Specialists in this area are skilled in planning and administering electrodiagnostic and electrotherapeutic clinical procedures, interpreting electrophysiologic responses, and proposing recommendations for subsequent management or intervention. So, there's a lot more of in this instance where you're going to be diagnosing, being specifically trained on certain devices, things like that. I personally haven't seen this implemented, and that's not to say that it doesn't exist, but if we look down here, this specialty certification has been around since 1986, and there are currently 204 of these specialists. So it's a pretty small percentage, and that doesn't mean that they aren't obviously very highly trained, or maybe it's just not as popular, or maybe there's different specialties who are able to use similar tools to them, and they're just not considered as much of a go-to. But obviously, it's something to look into, something that I'm not extremely well versed on, but wanted to make you aware of it and to provide you that information. Okay, so now we're moving on to the oncology specialty. So the oncologic specialty area within the physical therapy profession includes management of musculoskeletal, neuromuscular, integumentary, cardiovascular, and pulmonary rehabilitative needs of patients living with and beyond cancer and other chronic illnesses, including HIV. And it encompasses acute secondary sequelae of treatments such as surgery, radiation therapy, chemotherapy, and immunotherapy, as well as long-term secondary sequelae of treatments and palliative care. Okay, this is one of the newer certifications, and it was the first examination was administered in 2019, and as of 2020, there are 105 oncological specialists. But this is a really interesting part of physical therapy because cancer patients have such tremendous needs, and after they receive cancer treatment, they have so many other factors that go into helping them live a better quality of life, and many of those are related to dysfunctions in movement. And so I think this is a fantastic area, and is something that is likely only going to be able to going to grow as cancer continues to be a prevalent disease in the United States. And we want to make sure that we can address and serve these patients as best we can. So this is another more recent and exciting specialty as well. All right, let's go to the newest board certification specialty, wound management. Okay, wound management specialty area within physical therapy profession involves understanding, assessing, and maintaining the integrity of the integumentary system across a lifespan and in preventing and managing multiple types of wounds and integumentary conditions for optimal outcomes. In 2019, the APTA House of Delegates approved board certification in the area of wound management, and the first wound management specialty certification examination will be administered in 2022. So just as of last year, that was when the first examination went through, so we don't have any data about how many people currently are practicing in this specialty, but it's something that relates to individuals who have large wounds that need to be managed so they can heal appropriately. Physical therapists are some of the people, the boots on the ground, that are providing treatment to these patients. Wound care is a fascinating part of physical therapy. It's not my personal cup of tea, but it's definitely something that you should look into if you're interested in this specialty area as well. Well, there you have it. There's a quick look at some of the less commonly known board certification specialties within the profession of physical therapy. Obviously, this was just a quick overview to provide you some of the information regarding other specialties that are out there in the field of physical therapy. I've included in the description box down below a link to the website so you can go and review these specialty areas yourself. But now you're at least a little bit more familiar with this topic area and have a working knowledge and can decide if this is something that's worthwhile for you. Thanks, guys. Again, make sure to like, subscribe to our free email newsletter, and look forward to seeing you at the next video. Take care and have a great day.